Assalamualaikum and have a good day everyone, especially my students lecturer Miss Nurul Izzati Idrus. I am Nur Safirah binti Ilias and my matric number is 202-121-1918. I am from KBA1183B. So today, I want to present my speech to inform to all of you here. So let's start! Progeria is extremely rare. It occurs in 1 in every 4 million live births worldwide. About 400 children and young adults around the world currently live with progeria. Most kids with progeria don't live past age 13 years old. The disease affects of all sexes and races equally. So, this is the table of main point that I will elaborate to all of you. Hutchinson-Gilford progeria syndrome is a genetic condition characterized by the dramatic, rapid appearance of aging beginning in childhood. Affected children typically look normal at birth and in early infancy, but then they grow more slowly than other children and do not gain weight at the expected rate, which we call as failure to thrive. This condition does not affect intellectual development or the development of motor skills such as standing, sitting, and walking. A single mistake in a certain gene causes it to make an abnormal protein. When cells use this protein, this is called as progeria. So we move to the first main point, progeria symptoms. There are usually no symptoms when a baby is born, but they start to show the signs of the disease during the first year. They develop physical traits including slow head and weight growth, a bigger head, large eye that they can close all the way, a small lower jaw, a thin nose with a big tip, ears that stick out, veins you can see, slow and abnormal tooth growth, a high-pitched voice, loss of body fat and muscle, hair loss including eyelashes and eyebrows, and the last one is thin, wrinkled skin that shows spots. Children with progeria usually die of heart attacks or stroke. Progeria doesn't affect a child's intelligence or brain development. A child with this condition isn't more likely to get infection than other kids. We move to the second main point, progeria causes and risk factors. A mutation in the lamin A LMNA gene causes progeria. These genes make a protein that holds together in the center of a cell. With progeria, the body makes an abnormal form of lamin that called progerin, which leads to rapid aging, passed down from one generation to the next other. Researchers haven't found any risk factor for progeria. It inherits or passed down in families. Main point 3. Progeria diagnosis. The symptoms are noticeable. It's likely that a pediatrician will spot them during a routine checkup. If you see changes in your child that seem a symptom of progeria, please, I am begging to all parents out there, make an appointment with your pediatrician or family doctors. Your doctor will do a physical exam, test hearing and vision, measure pulse and blood pressure, and compare your child's head and weight to other kids at the same age. If your pediatrician is concerned, you may need to see a specialist in medical genetics who can confirm the diagnosis with a blood test. Before the genetic blood tests were available, doctor could only diagnose progeria with x-rays and observations. The last main point of this topic is progeria treatment. The picture shows about treatment for progeria syndrome. In reality, there is no definite treatment for progeria syndrome, but constant observation of the heart and cardiovascular vessels sometimes can help to manage the progeria syndrome of your child. There's no cure for progeria, but researchers are working on finding one. One clinical trial is looking at the kind of cancer drug which is of the eye to see if it can help to slow the disease or not. Here we have 5 ways treatment that can help to ease or delay some of the disease symptoms. So at here I will explain more details what I stated just now. The first one is medication and diet changes. Your child's doctor may suggest medicines and change to your child's diet to lower cholesterol and to prevent blood clots. A low dose of aspirin every day can help to prevent heart attack and stroke. Growth hormone can help with height and weight. The second one is physical and occupational therapy. This can help your child keep moving if they have stiff joints or hip problems. The third one is surgery. Some children may have coronary bypass surgery or angioplasty to slow the progression of heart disease. The fourth is at home. Kids with progeria are more likely to get dehydrated, so they need to drink plenty of water, especially when they are sick or it's hot. And the last one is wear sunscreen. Use a broad spectrum sunscreen with an SPF of at least 15. Reapply it every 2 hours or more if your child is swimming or sweating. Progeria is progressive, life-threatening condition. Hutchinson-Gilford progeria syndrome diagnosed in early childhood and in early adulthood, respectively. There are genetic conditions for which there is no cure, but there are treatments available. For those with HGPS, the prognosis is fairly poor, with an average lifespan of under 15 years. So I think that's all from me, and I hope you guys enjoyed watching my video. Thank you!